Hey, good morning, y'all. Dr. Benac. We are up at United Regional. We are at labor and delivery right now, and we're going to do a quick video this morning on what to expect when you come to the delivery room. So right behind me, you might be able to see this hallway. Down at the end of that hall is the OBED. That is where you come to be evaluated and checked if you think you might be in labor or if you're greater than 20 weeks and you have something going on. At some point in time for all of you, whether it's you go into labor on your own or you come in for an induction, we're going to bring you to labor and delivery, and so I want to show you around. Come follow me. This is one of our delivery rooms, and we've got it set up just to show you a couple of things. This is not a real person. This is Noelle. She's one of our mannequins. We practice with the nursing teams and the care teams up here. We practice drills and how to be ready for emergencies. So this is a typical labor and delivery room. We've got a great view. There are emergency departments on that side. You've got your baby warmer set up over here, and we have all of those in each room. We have a light that comes down from the ceiling to make sure that there's good lighting and that everybody can see. So very spacious rooms. Behind the camera there's a bathroom. We don't need to look there, but I just wanted to show you around a couple of things. So first of all, this is our computer system, and this is a screen that we use to do what's called electronic fetal monitoring. And it's a way for us to check on our babies while moms are in labor. And so there's two lines here. The top line is actually the baby's heartbeat. This is a patient who's in labor this morning with us, and so we can see the heartbeat. We see a wavy pattern, which is good. That shows that this baby's healthy. This baby's not in any distress and is doing well. And then on the bottom, we have a contraction monitor. So you can see these peaks are contractions. And so this patient's having contractions every couple hours. So we have these for every patient who comes in. And so when you come to labor and delivery, you can expect that we're going to need to start an IV. We're going to draw some blood work from you. We do that for all our patients. And then we're going to get you hooked up to these monitors. So a lot of times we use straps like this that go around front to back, tie in the middle, and then we have monitors. So one to measure the baby's heartbeat and one to measure contractions. And these go in the proper places. And so we do use these, and it's really helpful for us to know what's going on while you're in labor. A lot of people ask questions, can I move around? If you are strapped on with these, you definitely can move around. You can sit on the birthing ball. We even have monitors that are wireless now. So as long as baby's healthy and you're doing well, if you want to be up and moving, that's great. At some point, some women in labor choose to get epidurals. Once you get an epidural, it makes you numb basically from the waist down. And so you don't have full use of your legs, and so then it becomes a safety issue. And we recommend that if you have an epidural, that you are restricted to the bed at that point. So keep that in mind. If you have a specific birth plan or desires for what you want your labor to look like, talk about that with your nurse when you come in. And then from here, pretty much everything's going to happen. You're going to labor in here. You will have the baby in here. This is a delivery cart that we can set up with all the instruments and equipment needed for delivery, and we'll have that ready. Our nursing staff is wonderful. They're side by side with you throughout your labor process, and they're constantly keeping the doctor informed. If there's anything going on and we need to be here, they call us if we're not here already, and we come right away. You guys are our top priority, so that means the patients in the office, and I know you guys have been there sometimes when we get called out, but our folks who are here in the hospital having babies really take priority because we need to make sure that everything happens correctly and everything happens safely. So we're constantly talking with the nursing staff. We are coming here to check on things if needed, and then when it's close to time for delivery, they will notify us. We will come and we will be here for the delivery. And then typically you'll be in this room for an hour or two for recovery afterwards, just to make sure that you and the baby are doing well, and then we'll take you out to postpartum. So hopefully seeing this is helpful. We're going to do a little bit more of this. Might take you into the operating room at one point. I'll take you into the OBED so you can see that. But please send us your questions about what you want to see, what you want to know. I think sometimes seeing things is helpful. It just kind of mentally helps you know what to expect. And give us your questions. Send us our questions. We'll put that question form up if you have any questions related to labor and delivery, the hospital, recovery, anything like that. Hope you guys have a great day. Thanks for coming along with us today, and we'll see you soon.